I am so excited to have Elliot Connie with me today. Elliot is a solution focused therapist and expert. He's an author, speaker, and most recently, the developer of Solution Focus University, an online program for learning and mastering solution focused brief therapy. Welcome, Elliot.
Thank you.
And today, Elliot's going to be sharing with us just some tips on implementing solution-focused brief therapy with couples. And so I have a few questions for you, Elliot. First, what makes solution-focused brief therapy stand apart for couples work from other programs, two of the most prominent programs being the Gottman certification as well as emotionally focused therapy?
I think what makes solution-focused brief therapy with couples stand out in the world of couples therapy is the same thing that makes it stand out in the field of psychotherapy itself. And that is this approach is the only approach that really isn't interested in problem content in any way. I mean, just we're interested in the direction the couple would like to go in. So from the initial impact or the initial meeting with the couple, the first thing I'm interested in is where do you want your relationship to go? And what resources do you have within you to make that potential a reality? And what are the details related to that potential future? And that really is the basis of the work. And just this past weekend, I was on the faculty with John Gottman actually at a conference. And their approach is very different. I mean, equally valid, and I'm not here to, bash anybody's work, but it's just very, very different in that they're very interested in the problem and they're very, very interested in problem patterns and things of that nature. And as a solution-focused practitioner, I'm interested in something else.
And how would you say that clients respond to that different interest?
Favorably.
Yeah.
I would say. Most of the clients I get, most of the couples I get, they've seen other therapists before, and they've seen, they've been in other clinical scenarios, and constant feedback I hear is, and listen to the wording very carefully, because I hear exactly that. People say, I'm very happy to be talking to a therapist for whom I don't have to talk about the problem. And why that's such an interesting way of phrasing it is I'm not adverse to talking about the problem, and people should never misunderstand solution-focused for problem-phobic. But what I'm not doing is extracting the problem from the client as if it's something they have to tell me. And when people come into couples therapy, usually they're two people who aren't happy about being there. Like, for example, I saw a couple last night where the wife is very mad at the husband because he's had an affair. And she's pissed at him because now I have to come to couples counseling. I'm in this whole scenario, and she's also ashamed of herself. I should have seen it coming. I should have known. I feel tricked, duped, misguided, blah, blah, blah. And the husband is very ashamed because he has hurt his wife in this very deep and real way. So imagine if you walked into that room and you said, okay, tell me about your shame, tell me about your harm, it's just a difficult thing. But when you start off by saying, what are your best hopes from this conversation? What's your desired outcome for your relationship? What does your preferred future for your relationship look like? In spite of this hurt, what are the sorts of things you'd like to see beginning to happen? The problem comes out, but the client is in more control of it, and it comes out in the context of a solution, as opposed to just developing some sort of problem narrative. And I think that's why couples so consistently tell me that they like these conversations, because they felt more control of them. In particular, they felt more control of the problem content.
Awesome. So I think you answered several questions that I had on my list. But that's fantastic. So I'm going to jump to the last one, and that is, what are 3 foundational things that therapists can implement in their sessions right now? Even if they're brand new to solution-focused brief therapy, but perhaps they're not brand new to couples work, what's something that they can do today with this approach that will help them in this very next session?
Yeah. So number one, I would say the number one thing we ask people, we as a field, as a field of psychotherapists, when couples or clients come into your office, we ask them what brings you here. And first thing I would say is to replace that question, which what are your best hopes from being here? Which is kind of like, let me come up with an analogy. If you go to a restaurant, if your server said to you, what brings you here, you wouldn't experience that as a helpful question. The server just assumes what brought you here was hunger. So he immediately asks you an important question, he or she immediately asks you an important question, which is, what do you want? And then you say, a burger or spaghetti or, soup, whatever, right? You say whatever it is. So I would say the first thing is immediately ask clients, what do you want? And our way of doing that is we ask, what are your best hopes from being here? So that would be one thing that I think people could immediately do in their sessions to start developing their solution-focused skills. The second thing I would say is once they answer that question, follow it up with, if that desire became your reality, what would you notice? And start getting details. Details. And I'm going to warn you, you're going to get stuck. But when you get stuck, just ask another question that is linked to the desired outcome. And the third thing that you can start doing immediately is practice. I think in our field, to be very honest with you, we are, I'm trying to think of how to say this. I don't think we're doing a terribly good job of teaching psychotherapy, because psychotherapy is a linguistic skill. Mm-hmm. And we somehow teach it like it's a technical, like we're a technical ability. So for example, I can say to you, hey, Illy, come to my training, and I'm going to teach you the technique of the miracle question. That's how we teach in graduate school. Let me teach you the techniques associated with the different schools of psychotherapeutic thought. And we have to teach this like a trade, like a skill. If I'm going to become a master carpenter, I actually have to go and carve wood for years to become a master carpenter. Mm-hmm. And so the third thing I can say that people can start implementing tomorrow is practice. Because to get linguistically strong as a psychotherapist, and especially doing something solution-focused brief therapy, your language skills have to be sharp. And the only way to sharpen your language skills is to talk the language and to practice. And I don't mean practice with clients. I actually mean like doing exercises with colleagues. Mm-hmm. I mean attending trainings where exercises are common. And I also mean watching video examples of real sessions being done by, expert clinicians in the field. And you can find them. I mean, Google them. You can find people, not just me, but you can find people who have videos available. And when possible, transcribe them, because you have to get to learn the language. So those are the three things. Focus on the desired outcome. Number 2 would be ask questions about the client's preferred future. And number 3 would be practice.
Thanks so much, Elliot. I love this last point, well, all of them, but this last point in particular, because for years as a supervisor, I've been saying, we are question crafters. And these days I'm hearing that more and more from founders of the field that are, or really well-known therapists, talking about psychotherapy as a craft, as a craft of, as you're saying, linguistics, but also questioning in ways that that lead our clients in the paths that they have chosen, those things that they have said are their hopes. So I appreciate so much your time today and these very specific implementable tips. And thank you so much.
You're welcome.